Brilliant. Thank you for joining the webinar today. So just as I mentioned previously, this session is recorded, but please feel free to ask any questions. You can either pop them in the chat or raise your hand and we'll get to you as soon as we can. So on today's webinar, you've got myself, Anna, the trainer manager, and you've got Sandeep, the software trainer on the call, who will be taking you through the topics today. So some of the things we're going to focus on is looking at that consultation method and outcomes you can now add to the product when you're going through and completing those requests, how you can set up those intelligent routing rules to save you time, how you can set up message templates on a personal and an organisation level, again, save you time when you're replying back to patients, and then we'll go through what's coming soon and what's in our next release. So first of all, I'm going to go through and show you the consultation method and outcomes and how that can be configured as well. So if I just bring up the engaged client. So when requests come in, you might notice now as you go to complete or send to clinical, you now get the option to add that consultation method to that request. So if I click into my test patient here, I've done what I need to do on that request. So perhaps I've sent them a message forwarding on their sick note, for example, and now I need to get this information into the clinical system, or I might just want to complete this request if it doesn't need to be added to the clinical system. I would go to Action. I would go to Send to Clinical. And here is now where you can add that consultation method. So previously as a practice, you might have added it into this detail box, but to save you time so you're not having to write the same thing over and over again, we've now added it into this drop-down list. So basically what will happen is whatever I've done on that request, whether I've sent that patient a message, whether I've done a video call with that patient, it will also fill this box for me, but I can go in and change it as well. So for example, if I clicked on the drop down for consultation method, I might have had a face-to-face with that patient, a telephone call with that patient, a home visit. So I can now select from the list, and that will also add it into the patient's record when you send this to the clinical system, which I'll show you how that looks. I'm using system 1 to demo on today, but it does get added to the other clinical systems as well. So for example, if I'd sent back this patient a message, I would select message, and you'll also notice you have this outcome box as well at the bottom here. Now this is an optional box, so you can use it if you see fit. And if I click on this box here, again, you will see it gives me a list of outcomes I can add. Now this list is actually configurable again to your organisation, so you can add in your own list of outcomes. You can configure these and you can change which ones are available, which I'll show you how to do shortly. So I might have issued a prescription, for example, or a sick note, like I say. So you can choose from the outcome what has then happened. So for this one, we issued a sick note, for example. I would then scroll down my request and obviously select and deselect what I want to be added to the patient's record as normal. And then once I'm happy with that, I would click to send that to the clinical system. So if I show you an example of how that looks in the clinical system, so I've got one I've done previously, you can see on this one, the consultation method was face-to-face and the outcome was a sick note issued. So that adds that to the patient's record for you. So it just saves you from typing those consultation methods and outcome in each time you're dealing with those requests. So if you want to configure that outcome list, what you would do is you'd go to the management console if you've got access. If not, someone in your practice should have access. It will be in the engaged client under the menu, and it should say management console. You'll then be able to go down to your outcomes on the left-hand side. And you'll see here you can go in and add an outcome, but you can also reset the default outcomes, which will reset the list to the default ones we've set. So let's say I wanted to edit an outcome that was already in here. I would just click onto the pencil. I can then go in and change the text and click Save. And that will then update that for my whole organisation to use. I can also remove them. So if I didn't want this on here anymore, I can click to remove, click Yes. And again, that will no longer then show to my organisation. So you can really configure this list to make it work for your organisation and just save you time in typing in the same outcome over and over again. So that was added recently, so that's your consultation method and outcomes. So as I say, that shows when you complete a request, but also when you're sending that to the clinical system. The next thing I was going to show you was around our intelligent routing feature. So again, that's in your management console, and you'll see on the left-hand side, you've got this intelligent request routing button. So you'll have your system defined rules. So every practice will have these rules, and you can set up these rules, and these can be used internally and externally as well. So if you're just working as a single practice, you might want to route your admin request straight to your admin team, for example, so to your admin group. You might want to route your medical requests to medical secretaries, for example. You can choose where those requests go instead of coming into that incoming request box for someone then to manually assign them out. So it's all about saving time and also getting those requests to the right person the first time. So you can do it on a more general level, like I just mentioned, on your admin and medical, and even your health data uploads that come in, you might want them to go into a particular group for someone to then review before they get uploaded to the clinical system. You can also add your own organisation defined rules. So you can hone down in on those medical complaints, or whether that patient selected from letter from a doctor, prescription renewal, going down that admin route. And you can then again direct them to a particular group or to a particular colleague. So for example, on our system here today, we've got travel information going straight to the admin team. We've got the sick notes going to a group at the moment, but let's say I wanted to change that so that it went to the doctors. So all the sick note requests that come through, I want to go straight to the doctors group for someone to then review. So I'd highlight that in blue, click Edit Rule. I can then change who that would go to. So as I say, it can be an individual or it can be a group. So I'm going to pop this across to my doctors group. And as soon as I click Save, that rule will then be live. So if a patient now submitted a sick note, it would go directly to the doctors group. So you can do that for any complaint that patient can type in. It can be especially useful as well, for example, like your prescription renewals and prescription requests, to route them straight across to the pharmacist. But also if you are working and with another organisation, with another practice, you can route them across as well externally. So perhaps practice A and practice B are working together. I could route requests from practice A across to practice B. So maybe they've got a specialist, for example. So that's your intelligent routing rule. So if I now just go in as a patient and submit an admin query, I'll just show you how, if once I've selected sick note as a patient, when that request then comes in, how that goes straight to the doctors group. So I'm going to go through as a patient would, logging into their account, whether that's via NHS login or their Engage Consult account. I'm going to select the inquiries to myself, and I'm going to select that I'm sending through a sick note today. The patient would obviously then type in their query around their sick note, and I'll continue through. Won't upload a file today, and I'll submit that across to the surgery. So when I now go back from my surgery side, you can see we've had a new request come through for a sick note, and it's not come into that incoming requests group, it's gone straight to the doctors for them to then action. So it's almost like setting a task in your clinical system. Just a reminder, if you have any questions, please raise your hand or pop them in the chat and we'll get back to them as soon as possible. It doesn't have to be on what we go through today, it can be any question in general, and we can show you on the system. So the consultation method and outcomes and intelligent routing have been put in place to save you time, save the admin team time especially, instead of them having to manually assign those requests across. And Sandeep will now show you the message templates on a personal and an organisation level. So I'll stop sharing my screen and pass over to Sandeep.
Thanks, Anna. What we'll do is we'll get the screen up here. Should be. Okay, doke. So yeah, as Anna mentioned, we do have also message templates available to use on the Engage Consult client, whether that's on an organizational level or on a personal level. And we'll show you quickly how to add templates for yourself, your organization, and how to use those templates as well. We'll begin by looking at personal templates first. So in the top right corner, where you've got the little sort of symbol with the head in the circle, that's sort of your account. If you click on that, it will take you to your Engage account. And on the left-hand side where it says message templates is where you would add your own personal message templates. You can see I've got a few here. So I've got one for notes, one for patient messages, and one for questionnaires as well. We'll just look to add a new one just to see what that looks like. Template name, say test template. And with the message or note, what we can do is we can customize that so the patient name also appears automatically, so you don't have to put that in each time. So for example, if I put in hello, the way to do that is to put in the percent sign and type in patient name, end that with the percentage sign, and then just continue with typing up your message template from there. So again, we'll just put in a test. Thanks. Again. You can add attachments to your message templates as well. So for example, if you're sending out something around some other services that you do offer within the practice or within the local community, you can attach leaflets or additional documents to that template. Questionnaires can also be added, as it does highlight here. If you do add questionnaires, these can only be used when this template is used to send an outbound patient message, which is the tab up here. So those questionnaires will only be able to be sent through the outbound messaging system and not through the two-way messaging within the requests. But again, we'll just quickly show how to add those questionnaires. So for example, if we're adding the asthma questionnaire, for example, it's very important to highlight as well, once we've selected the correct questionnaire that we want to add, that we do actually add that questionnaire into the template. Otherwise, it won't attach itself to that message and it won't be sent. And obviously you'll see it has been attached here by highlighting the name of the questionnaire and asking if you want to delete it as well. Another thing we can do with these questionnaires is we have the one asthma question there, and then we also have the asthma control test questionnaire. We can add them both on and send them both at the same time. Saves a bit of time and effort again from where we're sending those messages to the patient. So we'll hit save, and we can see we've got both questionnaires attached to this template. And we can also set a response destination. So if you want this to go back to a specific colleague, you can select that colleague from the list. If you want to go back to a specific group, you can select a specific group. And if you do share, have data sharing agreements with other organizations, you can send it back to those specific organizations as well. So in this case, it was the asthma questionnaire. So let's put that to, let's send that over to the doctors. Hit save, and you can now see the message template has been added down at the bottom of the list, and that's ready for you to use. As it's a questionnaire that's been added for that one, it will only be able to be used in outbound messages. We'll quickly show that as well, actually. So if we're in create a message, and if we're selecting engage message, we're going to notify the patient, SMS or email. Select the patient that we have. From here, you'd be able to select whether you want to manually free text type your message or use one of your messaging templates. So again, here, once you select that, it will ask you to choose from the templates that you have. You've got your personal templates, which will only be used by yourself. And then you've got the organizational templates from there. So that test template, for example, the one that we've just created, you can now see it's all been added. Assignments gone back to the doctors as well. questionnaires have been attached and the message there for the patient as well. You can also see with the customization, with adding the percent symbols and the patient name, you can see it's automatically taking the patient's name from the request up there as well. We'll just cancel that and we'll go back and look at adding organizational templates. So to add organizational templates on the Engage Consult client, this can only be done by users who have access to the management console. So in the top right corner, the management console is up there. You'll see on the left-hand side, we have organization message templates. So these are the ones that are a bit more used by, I would say, all staff members that are messaging patients. So you can see they're a bit more broader in that sense. We've got appointment changes, DNA, flu jabs, a bit more general sort of messages from here. So if we're adding these, we can just do the same again. For this example, we'll put this one through the two-way messaging so we can see what that looks like as well. So test template. Again, we'll do the patient name in there too. Again, if you want to add any attachments, we can do so as well. Response destination can also be set from here. So let's put this one straight back into, can set it back to myself, for example. So we've saved the test organization template, and we can now see it's been added to the organizational message templates. So if we're going back and dealing with the request, as I said, for this example, we'll use the two-way messaging. So we highlighted in the outbound messages, the patient name was Bruce Wayne. So for this example, we'll select Jenny Johnson. So we're sending a message from here. This is the one from earlier. Organization test template. Apologies, yes, I should have written that myself. It does highlight there. My mistake. You can only have the response destination if it's sent via outbound messages. Apologies. Okay, so in that case, we'll go back to Jenny Johnson again. Click on the messages, and if we go to the templates, there we go, my mistake. We can now see the test organization template is now there, available to use, and we can also highlight as well with the patient name. That's also been popped in automatically. No attachments for this one here. Send that over. Just confirm that that message has been sent and that template has been used. Send, and that's that. So yeah, sorry, just to highlight for the organizational message templates. If you are setting these one up to be used in the two-way messaging, we can't add questionnaires and response destinations for those ones specifically, but for outbound messages you can do. I believe that's something that we're looking to add in the future, Anna, is that right? Adding questionnaires into two-way messaging?
Yeah, so we're looking at once you're sending back a message to that patient, you'd then be able to add another questionnaire. So, for example, if a patient sent through a questionnaire on asthma and you wanted them to actually complete the asthma control test as well, you could then just send that back in a two-way message to the patient to then fill in that additional information for you. Or if there's something, a related condition as well. So that will be on our roadmap to come soon.
Yeah.
Perfect.
Perfect. So I'll stop sharing my screen.
Thank you, Sandeep.
Pass back to Anna.
If anyone has any questions from what we've run through today, so the intelligent routing, message templates, or adding those consultation method and outcomes, please let us know. Or if there's anything else you may have any questions on. So I'm just going to go and share my screen and I'll take you through what's coming soon. If you just stop sharing your screen, please, Sandeep. Sorry, it's just loading at the moment. If you could just share the PowerPoint, Sandeep, of the coming soon page, please. So coming soon, we're going to be adding multiple photo/file uploads for patients. So patients will be able to upload multiple photos at a time. So this is something that's been requested from our practices. So especially if a patient's got a rash, for example, they might want to send you a couple of photos of that, especially, to get the right lighting, etc. So that will now be added to the product. So that should be coming in the next couple of weeks. We're also adding the alcohol consumption questionnaire. So this will be added to your outbound patient messaging questionnaires list. So you'll be able to go out and send that questionnaire out to that patient. It would come back into the system coded, as do the other simple coded questionnaires, for you to upload to the clinical system with the relevant codes attached. Again, that will be coming in the next couple of weeks to the product. We then have our demand management enhancement. So if any of you on the call have to go in and manually update those bank holiday hours when we have a bank holiday age consult, you'll no longer have to do that from when we have the new enhancement come. So again, this will be coming in the next couple of weeks. So you'll actually be able to go and pop in if you're open or closed on bank holidays, and that will use the English calendar to set the bank holidays in for you. So you don't have to remember to go and do that each bank holiday. The system will just do that for you automatically. And then a big one as well we're adding is the customizable admin list. So at the moment, as the patient goes through to submit an admin query, the list is currently set. So for example, there's sick note, prescription request, travel information and letter from a doctor on there, and something else. You'll actually, in a couple of weeks' time, be able to go in and customize that admin list. So you'll be able to actually pop in there what you want your practice to deal with on that admin query route. So you'll be able to add in your own list for the patient to then select from. So that will be a big one, and that will really then mirror your processes you use in the practice as well. So keep an eye out for that one. That will be in release 98, which is our next release coming. So just to show you our roadmap, just so you can see what's coming soon. Oh. Apologies, just waiting for my computer to load. Here we go. So this roadmap is available to anyone to have a look at. And also, if you have any feature requests as well you'd like to be seen added to the roadmap, again, please just let us know and we can get them added. And also, we really find your feedback helpful. So sometimes we might message out to say, is this how you'd like it to look? Does this make the most sense to you? Just really to make sure we are, understanding your needs and to make sure the product works for you. So on our roadmap, what we have coming soon is, you've probably heard us say before about the app that will be coming soon. So you'll be able to send push notifications to your patients. We've also got some more simple coded questionnaires being added to the product. And again, if there's any that you want added that you use on a daily basis, please let us know. Obviously, you'll be able to send these messages to your patients and these questionnaires via email, SMS or push notifications. So it's a great way to reduce your SMS costs by having those other two options there available to connect with your patients. And we're also looking at adding translation into the product as well. So as that patient submits the request, they can select their language. They can answer the questions in their language as well. And the product will be translated for them. And then when it comes into the engaged client for you to then deal with the request, we'll translate that back to English, but you'll also be able to see the original translation there as well. So if there is anyone in your practice that speaks that language, they can obviously look at that original translation, or you can see it in English, and obviously that will be uploaded to the clinical system in English as well. So that's just to increase accessibility of the product and ensure more patients can use it. So there's a lot on our roadmap at the moment. So what we'll do is we'll send out the link when we send out the webinar recording, so you can take a look at that. But again, if there's anything you'd like to see added on there, please just let us know. Brilliant. So is there any questions? You can either pop them in the chat or pop your hand up. Please let us know. We've got about 4 minutes left on the call. Nope. If you think of any questions after the call, please just email training@engagehealth.uk and one of the team will pick that up and answer back. So that can be if you have any training needs for your practice, so you want to jump on a training session with us to go through kind of what else we can do to customize it to your organisation and make sure it's working well for you to save you time. Or you might just have a couple of questions you want to cover off. Anything little or small, please just let us know. Thank you for all joining the call today. If there's no questions, that's everything from us. But thank you for joining. And as I say, the recording, and we'll send the roadmap link out as well after the call. Thank you.
Thank you. Bye.
Bye.